Good afternoon, ma'am. Our report is about squamous cell carcinoma of supraglottis. Our catchy title is I Am Speechless. For our objectives, general objectives, to obtain knowledge on medical and dental significance of the squamous cell carcinoma of supraglottis and the associated treatment of surgery. For our specific objectives, to understand the signs and symptoms, risk factors of the SCC of the supraglottis, to understand the pharmacological and non-pharmacological therapeutics that can be given to patients with SCC of supraglottis, to learn the correct dental management of patients with SCC of supraglottis. For the general data, name MG, 51 years old, female, Cabanatuan Isabela, Filipino and Roman Catholic. For the chief complaint, for dental, nahihirapan ako makipag-usap at humanga ng maayos. For the medical, right supraglottic goiter mass. For the history of present illness, for the dental, upon consultation, patient has difficulty in communicating and opening of her mouth. It is due to the operation done prior to oral examination, but she does not feel any toothache or any symptoms that will need dental procedure. For the medical, 5 years prior to consultation, patient experienced intense coughing and usually waking up from sleep due to difficulty in breathing. She did not take any medication nor consulted a doctor. 3 years PPC, patient felt a slight elevation or bump on her right neck. It is asymptomatic but there is a slight hoarseness of voice. There is no medication or medical consultation made. 4 months prior to consultation, patient felt difficulty in breathing and swallowing. The mass on her right neck increased in size. She then decided to have a medical consultation. Upon consultation, a supraglottic mass was observed on her right leg. For the present medical history, negative in hypertension and diabetes, complete vaccination and no known allergies. For the family history, mother deceased due to heart attack, father is positive in hypertension. She is the eldest daughter. For the personal and social history, domestic helper from 1992 to 1996, no vices, caffeine drinker 3 times a day. For the review of system, she is positive in itching and nosebleed, positive in shortness of breath and difficulty in breathing, and chest pain. For the general survey, for the blood pressure 130 over 70 millimeter mercury, for the pulse rate 82 BPM, respiratory rate 19 BPM, temperature is 35.8 Celsius, weight is 54 kilograms, height is 158 centimeter, and for the BMI is 21.6 and it is equal to normal. For the physical examination, positive in itching and nosebleed, and she has a positive in swollen glands and stiffness and goiter, positive shortness of breath and difficulty in breathing, and positive in chest pain. For the signs and symptoms, for medical, persistent dysphagia or difficulty swallowing, painful swallowing, earache, cough, and coughing of blood. For the assessment in medical, squamous cell carcinoma of supraglottis. This is the location of supraglottis. What is squamous cell carcinoma of supraglottis? Supraglottic carcinoma is a dominant laryngeal tumor. Patients with supraglottic carcinoma often present with non-specific throat pain, dysphagia, and neck lymphadenopathy as a primary disease features. These patients tend to present for care in advanced stage and have poor overall survival. Males are more affected than females, and usually the older age group, less than 50 years, are more susceptible. Risk factors include smoking and alcohol. SCC arises from the epiglottis, epiglottic fold, false vocal fold, as well as the deep pre-epiglottic and paraglottic space. It metastasizes early to cervical lymph nodes. Staging of SCC of supraglottis. and neck. For the plan of dental, immediate dental procedure needed by the patient must be done prior to surgery. Usually, the treatment needed of abscess of supraglottis will cause difficulty in mouth opening. For the oral care and management, use a non-abrasive toothpaste. Only use a pea-sized amount or smaller of non-abrasive toothpaste. Brush for 2 minutes using gentle rotation or circular motion while holding the toothbrush at 45-degree angle to the tooth surface. Floss daily with a wax floss. For the plan for medical, computed tomography, supraglottic soft tissue mass causing asymmetry of the laryngeal side and cartilage sclerosis. The mass displays moderate enhancement and large lymph nodes is less than 1.5 cm in short axis. Computed tomography can assess tumor extension. MRI. The MRI examination requires a neck coil to obtain adequate resolution. Section thickness should be 45 mm for the neck coverage and 2 to 3 mm or 0.1 to 0.2 mm interstice gap for the focused study of the larynx. For the medical, total laryngectomy and lateral neck dissection. Communication aid for surgery, transesophageal prosthesis, electrolarynx, and esophageal speech. Therapeutic, pharmacological, sultamicin silgram 750 mg, take 1 tablet every 12 hours, 8 a.m. to 8 p.m. for 7 days. Juvenile, dissolve 1 glass water and drink twice a day. Metropolol tartrate 50 mg, half tablet, once a day for 8 a.m. Non-pharmacological, daily BP monitoring at home and record. For the expert's opinion, you must take necessary radiographs such as panoramic and full mount radiograph. These steps will identify potential source of infection and needed dental work after surgery, such as caries, broken restoration, and partial dentures, clean and adjusted. Perform a complete prophylaxis with a fluoride treatment and home care instruction. Dr. Tabihe's opinion. For our journal, Oral Care of Head and Neck Cancer Symptom Management. We present the result of retrospective study of 903 patients treated with conservative surgery for carcinoma of the supraglottic larynx so we can evaluate our management of supraglottic cancer with different types of surgery. In 301 patients, an extended supraglottic laryngectomy was performed. The recent selective use of transoral laser resection appears to be rational approach. The 5-year uncorrected survival was 84%, 81%, and 76%, and 55% of stages 1, 2, 3, and 4 respectively. The most common site of local regional failure was cervical lymphatics. The percentage of the occult disease in the no neck was 21% of epilaryngeal supraglottic location. Locally advanced and G3 tumors have a higher frequency of lymph nodes involvement. There were no differences between comprehensive and anterolateral elective neck dissection. A bilateral elective neck dissection is recommended. In histologically positive neck disease, the survival rates were better with post-operative radiotherapy only in cases of extracapsular spread. For the dental relevance, before starting any treatment, dentist has to assess the presence of squamous cell carcinoma of supraglottis to determine the treatment modification needed on the dental procedure. SCC of supraglottis is serious condition and a clinician must not skip and forget to check medical history and medical referral of the patient prior to any dental procedure to reduce the risk of emergency. An interesting concept. I'm speechless.